From VOA Learning English, this is the Health Report. Many college students have stopped taking class notes by hand. Instead, they type on computers. But scientists say typing notes is less effective. If you need to remember something, they say, write it down. Writing notes by hand is much better for the long-term memory of ideas or conceptual information. That is the finding of a 2014 study published in the journal Psychological Science. So, turn off your computer if you want to remember something. Computers can take your attention away from your work. If you have a computer, you might send an email or check a sports score. Scientists also say computers may hurt performance in school. Their research showed that students who type notes often transcribe the information. That means they record what the professor says word for word. They may not think about what they are typing. The study found that electronic notes contained more words, but scientists say the act is mindless. However, students who take notes by writing them first process the information they hear. Then they record just the main points. This process leads to a deeper understanding, researchers say. In the study, students listened to a teacher and then took a test. Some students typed their notes, others wrote them. Both groups performed about the same in remembering facts. But students who typed did much worse on questions that require understanding of an idea. Researchers found that those who wrote their notes also remembered the tested information better a week later. For VOA Learning English, I'm Alex Villarreal.
From VOA Learning English, this is the Health Report. Telemedicine is the name for when doctors give advice to patients by telephone or the internet. It also describes when healthcare providers in rural areas connect with specialists in big cities. Telemedicine has existed for a long time. But the rise of smartphones, tablets, and webcam-equipped computers is raising telemedicine to new levels. Some healthcare systems in the United States now offer virtual urgent care. Patients see a doctor by video chat without having to leave home. Diana Ray is a nurse educator in the northwestern state of Washington. She recently demonstrated how virtual urgent care works. She used an iPad tablet and Skype, the video chat service, to have a virtual appointment with Dr. Ben Green. He had the patient describe her symptoms. Dr. Green decided that the problem was a sinus infection after having her perform a facial exam that he demonstrated. For medicine, he prescribed an antibiotic. Dr. Green says about 3 out of 4 of his patients have health problems that can be treated like this through virtual urgent care. That means a video chat could replace a visit to the doctor's office in some cases. Dr. Green treats patients by Skype for the Franciscan Health System based in Tacoma, Washington. It operates hospitals and other healthcare facilities. Franciscan charges $35 for this kind of virtual house call. That is much less than the cost of going to an emergency room, a doctor's office, or an urgent care clinic. After trying the video conference, Diana Ray says she would have been happy to pay the $35 when she was recently home with a bad cold. For VOA Learning English, I'm Carolyn Presutti.
From VOA Learning English, this is the Health Report. Have you heard of mindfulness meditation? Meditation, or deep breathing and quiet thinking, used to be found only at spiritual places and yoga centers. These days, mindfulness meditation can be found almost everywhere in the United States, from offices to schools, from prisons to the military. The central idea in the mindfulness meditation movement is experiencing the moment, thinking about the present, not the past or future. The mindfulness movement has been going on for many years, but now it is being called a revolution. Supporters say this revolution may reduce tension and improve the body, mind, and spirit. For example, many people feel nervous when they have to visit a doctor for their teeth. You might be surprised to hear that the dentist can feel this way too. Alana Bauer is a dentist in Washington, D.C. She says her small workspace and the exacting nature of her work can create tension. Ms. Bauer says she reduces her tension with mindfulness meditation at a yoga center in the city. She says she believes the exercise quiets the noise in her head and even slows her heartbeat. Hugh Byrne has been teaching mindfulness meditation since 2000. He says being mindful is all about thinking about the present. Critics dismiss mindful meditation as a temporary popular interest. They say it ignores the moral substance of the ancient Buddhist tradition of meditation. But Mr. Byrne notes that not all people are religious. He says, mindfulness meditation is a broad doorway open to all kinds of people. And dentist Alana Bauer says she is thinking about trying Buddhism. For VOA Learning English, I'm Carla Babb. From VOA Learning English, this is the Health Report. A man enters a store to buy milk. He walks out of the store with milk. That is all, milk. At the same time, a woman enters the same grocery store to buy milk. She buys it, but she also buys chicken and lemons to make dinner that night. And she gets some wine for a party later that week. Then she remembers to buy a card for a friend coffee for the morning, and some cleaning supplies. That is the difference between the female and male brain, simply explained in a grocery store. Generally speaking, men do one thing at a time. Women do several things at the same time. Now, some brain research supports this theory. Scientists at the University of Pennsylvania studied brain images of 949 people from 8 to 22 years old. They found that male brains have more connections on one side of the brain or hemisphere. In the female brain, they found more connections between the right and left hemispheres. The left side of the brain is known as the side of reason. The right hemisphere is known as the creative side. Regina Verma is a professor at the University of Pennsylvania. She co-wrote the study. She says when women are asked to do something difficult, they are likely to use both the reasoning and the creative side. Men, she adds, generally use one or the other. As a result, men generally deal directly with a problem. Women are more likely to take a less direct path to find a solution. But Dr. Verma says the study shows generalities. She says it should not lead anyone to expect some behaviors from women and others from men. For VOA Learning English, I'm Alex Villarreal.
From VOA Learning English, this is the Health Report. Americans are interested in exercise. When an exercise method promises to help a person lose weight or get fit, it can become very popular very quickly. We call these exercise trends. One current is CrossFit. CrossFit is a company and training program established in California in the 1970s. The number of CrossFit centers, or gyms, has doubled every 2 years. And not just in the U.S. There are CrossFit gyms in South America, Europe, and Asia too. CrossFit is a program that works the entire body, and it is not an easy one. CrossFit is known as one of the hardest training programs in the exercise world. The U.S. Marines, professional sports teams, fire departments, and police forces use CrossFit. But it is also popular with people who work in office jobs. CrossFit uses weight training and movement like running and jumping. The movements are simple, but performed at a very intense level. Kate Garufi is a trainer at District CrossFit in Washington, D.C. She says the goals are to get stronger, improve the heart and blood system, and become looser. There are more than 8,500 CrossFit gyms worldwide. People train in groups in the CrossFit program. Results are measured by how long it takes to complete a set of exercises. CrossFit group members say they began to feel like a family. They get support from each other, but also added pressure. Members say they do not want to fail their group. Critics say CrossFit has a high rate of injury. members can experience muscle damage, especially shoulder injuries. But CrossFit supporters say a good trainer can help people avoid injuries. For VOA Learning English, I'm Carla Babb.
From VOA Learning English, this is the Health Report. A popular expression goes, "What does not kill us makes us stronger." But when it comes to being bullied, that may not be the case. Increasing evidence suggests that the effects of being bullied do not end with childhood. The psychological and physical damage, like anxiety and depression, can continue into adulthood. A recent Duke University report supports other research that shows bullying can have permanent effects. The report is based on research that began in 1993. The Great Smoky Mountains study observed 1,420 children from western North Carolina for years. The scientists followed the people as they went from childhood into young adulthood. The research showed that those who were bullied were at higher risk of long-term mental health problems. It found that adults who were bullied as children had higher levels of C-reactive protein, or CRP. CRP is a sign of nervous tension. Higher levels of CRP are linked to health problems. The study also found something completely new about bullying. It seems that bullies are healthier than those bullied in terms of CRP levels. The study found the lowest levels of CRP in people who had never been bullied but had bullied others. Experts on bullying worry about that message. Catherine Bradshaw is Deputy Director of the Johns Hopkins Center for the Prevention of Youth Violence in Maryland. She says that a possible health gain should not be understood as permission to bully. Professor William Copeland led the study. He says a higher social standing for bullies might explain their lower CRP levels. For VOA Learning English, I'm Alex Villarreal.
From VOA Learning English, this is the Health Report. The ancient Romans are known for military strength and political complexity, but the empire also developed a public sanitation system. The Romans built public latrines or toilets with many seats and washing areas. They also brought in fresh drinking water and warm water for cleaning. They even had laws to keep the towns free of human and other waste. But new archaeological research shows that baths and public toilets with washing areas did not lower disease rates. In fact, some diseases slowly increased compared to the period just before Roman rule of Europe. Piers Mitchell is with the Archaeology and Anthropology Department of Cambridge University in England. He led the new research. The findings suggest that Roman toilets washing areas, and sanitation laws had no clear benefit to public health. Mitchell gathered evidence of insects in ancient latrines and human burials. He also examined combs and cloth from archaeological digs across the Roman Empire. Although the Romans were known for regular bathing, Mitchell found lice and fleas were just as widespread as in earlier times. So, why did the Roman development of sanitation systems fail? Mitchell says it may have been the warm waters of the bathhouses that people shared. The waters were often not changed, and scum or a layer of human dirt would float on the top of the bathing water. He says there is an upside. It seems that while Roman sanitation may not have made people any healthier, they probably would have smelled better. For VOA Learning English, I'm Ann Ball.